All right, gastrocnemius time. Let's just focus on the gastrocnemius all by itself. Turn transparency on. So we know a couple of things. We know that the origin is up there at the top of the epicondyles of the femur. We know the insertion is down at the heel. Pretty straightforward, right? We also know that it's roughly half, the body of it is roughly half of the lower leg. Okay, and you know, a little higher, but it depends. As it builds, it grows, and it'll build downwards. But in her, it's going to be a little bit less than half. And then we also know that there is a particular and peculiar slant that I'm drawing right now in a nice straight fashion here. So it's going to be this thin muscle that's going to sit on top of the soleus. One thing to just remember, and you'll see this in Elliot Goldfinger's book, but he calls this the column. So those two different segments are going to be really relevant. So I'm just going to outline them in red. Okay, we're going to have the body of the muscle, and then we're going to have the column itself, which is very visible as somebody's walking around. And then, of course, we've got the tendon coming down as well. Let's outline this from a back view. Okay, the origin, again, top of the epicondyles of the femur, and it's going to come down from there. Okay, shooting down. Basically, we get the column, so let's treat this as a straight line. Okay, we're going to have that column doing some work. Let's say not even end it. Let's give it a bit of a triangle shape that it terminates in. And then the fibers themselves of the muscle are going to veer out. Okay, start to fill in, because remember, the body doesn't go quite halfway, so that's about as far down as I'm going to go. We're going to veer up, and then we're going to pick up the other side, like that, and then down. So that might be a really nice geometrical reminder of this form, something that'll really help you get it. Lateral is higher, the medial is lower, but they're at this nice angle as well. So let's get that shape into our actual sculpt here. So let's lay it against from a side view, which we've already kind of done. And why don't we, while we're at it, why don't we set up that angle and really get things pushed? And what I'm setting up is the outside angle, not the inside, because I'm going to come into the inside and treat that differently. And I am thinking about the column versus the body. So you can see me moving those in two discretely different sets of movement. Okay, G for solo, that's my hotkey, but you can have it. And come in again, check always, because you know, before you know it, you're up against there and something's gone wrong. Okay, so from a side view, we got something. I'm not going to say it's pretty, but we got something. And I think where we need to work the most at this point is in the back view. So again, pulling in, and then also really making sure that the origin is up there, directly lined up with the femurs. And that's going to mean that I got to recalibrate and like that. Okay, and we got to come out and out and out like that. There you go. I'd say that's pretty decent. Okay. Turning transparency off and make sure that everything's sitting okay. And get that lined up a little bit. Key got away from me. Let's separate out the column from the muscle. I'm going to turn RGB off and press Alt. Okay, and just make that really clean and really simple. And I'm going to drop that a little bit below the head of the tibia. So this is my knee. And then notice I'm just dropping that down a little bit below. And you can come in with clay buildup. Clay. Move that in. Oof. Let's use regular clay. Let's use back face masking. Start to build that up a little bit. Okay, but don't do too much. If you do more than what I did, you can run into trouble. I mean, I'm already running into trouble. And we absolutely have to deal with this when the rest of the model is on there. The rest of the lower leg. Okay. It's probably enough. Control Shift click. Alright, and we've got alignment to do. So let's do that part right now, and I'll do that with mask by polygroup set to 100. And maybe I'll just make sure that that's unmasked. You can always use move topological. That's a nice way to really shrink stuff down as well. Okay. I can turn that mask by polygroup off now, since I'm masking since I'm masking everything, or move by polymesh. Okay. H polish. Get a nice strong column moving in there. Okay. Notice this little plane I'm creating right here, really important. And then also I'm going to come in here with clay buildup, and this is really important as well. It's hard for you to see, but we can't leave this volume exposed like that. And you need to adjust it. Make sure back face masking is on though. And so I'm going to pull it all the way in. Have it make actual contact. Okay. Yeah, just fill that space in. But don't eclipse that border of the tibia there. And I'm going to pull this side in. And I'm going to pull it forward to eclipse some of the soleus. You know, and that's just one of the tricks, is just pull it forward a little bit and just have it eclipse the fibula, or the soleus, just the tiniest bit. But then how much of that of the head of the fibula do you see? You know, and also on top of that, in fact, let's go back to mask by polygroup. Let's get some of the soleus up there. What I want to do is have just the head of the fibula exposed. So anything else really just needs to give way. Alright, so I'm increasing the soleus slightly. Okay, and I'm gonna make it so that these guys push out. You know, and that might start to look a little bit wrong, but I'm going to come back in as a separate move and flatten things down a little bit. But I'd say we're pretty close. Just going to give the soleus this room all the way to the gastrocnemius. Okay, H polish, or better yet, just polish. And let's control, click, and drag and start to get some of the shape. In fact, yeah, polish was really the right choice. You can see that right now. Just really shaping that really well. Can use the female anatomy figure as a guide for this shape. I'm going to look at that here in a moment. I'm going to flatten that. I'm going to flatten that. Flatten the soleus. Mask by polygroup is still active. But now you see everything starting to come together. You know, and you may still have to do some tweaking. But we're in really good hands here with this brush. Let's add a little bit of volume. Okay, what are we at? 15 minutes on this? You've been watching me mess around with this? Remember, you've got reference to check this out. Don't let the gastrocnemius show from the front like that. If anything, it only is going to show up here at the top. Move that soleus around. Alright, and we've got now the little details to think about. We've got those digits, and we've got those other, the ones that really manipulate the digits to think about. So let's do that in another video.